Healthcare is too expensive. Employers are offsetting costs onto their employees. Who will make health benefits affordable for hardworking Americans and their families? You will. This is the Empowering Plans Podcast, a show dedicated to helping you once again emphasize the benefit in benefit plan. Now prepare to learn, plan, save, and protect with the FIA Group.
Hello, everybody. Ron Peck, Executive Vice President and General Counsel with the FIA Group. On the line, I wish I could say I'm in studio, but I'm calling from my bunker, safe thousands of feet beneath the crust of the earth, deep inside my bunker. No, I'm just kidding. I'm actually calling you from a little fort that I built with toilet paper rolls. No, that's not true either, but I am on the line rather than in person. Also on the line is the guy that I count on for all the fact checks, Brady Bizarro. How you doing, buddy?
Hello, Ron. Hello, Brady, that is. A little confused given all the interruptions, but I'm here as well, Ron.
Yeah, you're a little flustered. It's tricky, when you're calling from a different environment. So for those of you who are wondering why it sounds, the quality of the sound is a little bit more like a webinar and less like a podcast, it's because, like I said, we are telecommuting. Like many employers across the country and in the fine Commonwealth of Massachusetts in particular, the FIA Group as an employer to protect the health and safety of its employees and those around us made the decision actually last Friday that starting the following Monday, we would be telecommuting. So for those who are wondering and listening to this recording and thinking, well, what day is that? That was Friday the 13th, which, it's got its own mysticism around Friday the 13th and what that means. However, for us, it meant get your stuff packed up and get out of here because starting on Monday the 16th of March, you're going to be working from home. So it's been about 48 hours of the majority of the company telecommuting. And I got to say, Brady, I haven't really seen a slowdown. The number of emails coming in, projects and results going out, and the work that we're doing. I've been very impressed by the company's ability to sort of circle the wagons and work from home. How about you?
Yeah, I think you're right. I think part of it, honestly, is we're already, what seems like 4 or 5 days into this. I think people are just so bored at home at this point that they're actually looking forward to work. I know I am. I've got like 10 different TVs on, as you can imagine, with all the news stations, all the coverage I can get, and it's really not enough. So I think we're going to see.
Yeah, I hear you. So I'm in the process between working. Brady, I don't know if you have a hamster or something like that, but I think most listeners know that I've got an incredible 4-year-old here with me, and my wife and I are both working full time. And we're pulling straws, and whoever pulls the short straw is the home educator, and whoever gets the long one is the one who gets the work. So I think your point is a good one. And of course, for those wondering why we're telecommuting, well, first of all, good for you. Apparently you found a safe spot under that rock. This is, of course, in response to the COVID-19 or coronavirus pandemic with which we're dealing. Massachusetts, again, we've got a nice spike here. A number of other states are dealing with it, some to a lesser degree, but certainly this is a national issue. And the FIA Group, we come at this from a very interesting perspective. One, because we obviously are an employer ourselves. We have employees. And so we need to take care of those employees like any employer. You could be a coffee shop, you can be a dry cleaner, it doesn't matter, or you could be the FIA Group. You're an employer with employees. You need to be looking out for their safety. Additionally, we have the same questions and concerns as everybody else. We have a self-funded health benefit plan, which, of course, we've talked about frequently and often on this program about the quality of our plan and how proud we are of our plan. We need to also take into consideration, hey, look, what happens if somebody is, sent in for a test? Are we paying for that test? If they're diagnosed, what are our responsibilities as far as the cost of treatment? So as a health plan sponsor, we're also dealing with the same issues as our clients. However, the third item, which I think kind of separates us from the pack, Brady, is the fact that many other employers and plan sponsors are reaching out to us with questions and concerns and asking us for our guidance on things that, frankly, are really cutting edge. And they use the word unprecedented, and in this case, it really is. You're looking at everything from, do I need to make a change to my benefit plan document in order to extend coverage for testing, for treatment? What kind of expenses and costs can I expect to see arising from this pandemic? What is the risk to our plan? What should we be covering? What should we be excluding? Additionally, there's coordination of benefits questions. You're hearing a lot about both federal and state government setting aside funds to pay for testing, to pay for treatment. Well, that naturally begs the question, are those funds primary? Do they pay prior to or before the plan pays? Or are they sort of secondary? Do they kind of come in and cover the gap when the plan doesn't cover something? So there's a lot of questions as far as what's being covered, what's it going to cost. And Brady, I think that we're doing the best we can, certainly, to, like you mentioned, watch all the televisions, read everything we can, and surmise what the responsibilities are going to be for the plan. And we are certainly doing the most that we can to prepare our clients, but at the same time, we might be updating our guidance as things develop. So do you want to talk about some of the things that you're tracking right now, Brady?
Sure, Ron. Yeah. So as you said, we're all in the same boat here. Things are really evolving day to day. I can't recall a situation really ever like this that has tested the healthcare system in this country. And with respect to employers, like Ron mentioned, there's so many questions that we're getting really by the hour into our consulting inbox about, whether employees have to continue coverage for, this new potential leave that's being floated in Congress, what has to be covered. So I think maybe it makes sense at this point to just go over. Most of our clients will know that, or probably will have heard about over the weekend, the House Representatives passed a bill to address the COVID-19 crisis. They're calling it the Families First bill. And importantly, this bill is now being sent over to the Senate, and we should expect that it will change a lot, or maybe be added to at least. But for now, I want to point out sort of three things in this bill that would directly impact our clients and us as an employer as well, because it's important that employers know what they're going to be expected to do in the coming weeks and months to respond to this crisis. So one of the first things is this emergency FMLA. So part of the bill is going to require here employers that have fewer than 500 employees to provide employees who've been on the job for at least 30 days up to 12 weeks of job protected leave for various conditions that have to do with COVID-19, or caring for someone in your family who has the disease, or for childcare if your school has been closed. And as we know, many schools across the country have been closed. So there was nothing explicit in this bill that said health coverage had to be continued, but most experts, and our own opinion here, is because this is an emergency FMLA provision, and FMLA does require coverage to be extended, we're recommending that if this passes in its current form, that employers do continue health coverage for this special 12-week FMLA period. And I'd be surprised, like I said, if in the Senate bill when this changes, I think they probably clean this part up and make sure they clarify that point. But in any case, the intent is clearly to mirror the FMLA in an emergency version. So we would recommend continuing coverage there. And of course, that would involve a consultation with your stop-loss carrier to make sure that you're not having gaps. The other important part of this bill, as it passed over the weekend, was, and Ron mentioned this, the coverage for the testing for COVID-19. So there's an important distinction, obviously, between testing and treatment. And this bill squarely addresses private health plans, that is ERISA plans, because remember previously, a number of states had issued orders requiring fully insured plans to cover the testing. Now we have a bill that would apply to all self-funded plans, including grandfathered plans, and require them to cover diagnostic testing, including at a provider, urgent care, or an ER, at no cost to the consumer. So that means no cost sharing. Importantly, we've been asked this question, that does not require plans to pay 100% of the bill charge. It just means that you can't have any cost sharing imposed on the plan participant. So that's an important distinction, and we expect that'll make it into the final version of the bill. The last one, just quickly here, Ron, is about emergency paid sick leave. Again, we're really in uncharted waters here, and we have millions of employees around the country that are worried about this issue. And so Congress added a provision here, or the House did at least, that would require, again, employers with less than 500 employees and government employers to provide employees 2 weeks of paid sick leave at their regular pay if they're put under a quarantine or they seek diagnosis or treatment for COVID-19. If they have to care for a family member or a child because of a closed school. and that will be through the end of the year. So there's a lot of things in this bill. Those are the three top ones that we picked out that would apply directly to employers, though, and we're watching that every day as it develops.
So one of the other things that, there's been a lot of dialogue about it as we talk about, well, who's paying for what and what laws are being passed and what applies and what do we need to do in order to be compliant versus what can we do sort of more of an optional elective benefit in order sort of a best practices approach. Something else that we're hearing a lot has to do with what is this going to look like from a cost perspective? It's one of those things where naturally it's one of those once bitten, twice shy. I think that a lot of people in our industry, anytime there's any kind of new or uncharted disease, the first thing they think of are, specialty drugs and, some expensive surgery. And the thing is, and it's tragic in a lot of ways, but, the FIA group, we do a lot of subrogation. And what will happen is often there will be a very catastrophic accident. Someone is severely injured to the point that they're either killed on the scene or they die shortly thereafter, and it's tragic. And what will happen is when it's that kind of incident or accident, people will say, wow, that's probably going to be a really big subrogation claim. There's probably going to be a lot of money going around. And the thing is, it's not. And the reason it isn't is because when a person is killed in an accident, there really aren't that many medical bills tied to their treatment because there was no treatment. And as a result, there's really nothing to recover on behalf of the plan. So it's absolutely a tragedy. But to assume that because it's a tragedy, it therefore becomes a major expense for the plan, it's not necessarily true. And I'm starting to sort of see the same thing here where there's this attitude that because it's a pandemic and because it's so big, that's naturally going to mean a huge cost for the plan. And as things develop, certainly that can ultimately end up being the case as we see, hopefully, in a few months or even years of vaccine. With the limited supply as we start to ramp up, I can imagine it being rationed out depending on the type of person we're talking about and being a little bit more expensive. But when you think about the disease itself, first and foremost, let's not forget that at least for the time being, until there's some sort of a mutation, that the disease itself seems to impact most severely the aging population. And that population, you're looking at the demographics, they're talking about people who need to be hospitalized or on respirators. We're talking about people, they say over 65, 70, in their 80s. Many, many of those people, as you know, are enrolled in Medicare, not on these private benefit plans. And so as a result, I think the first sort of fund that's going to get punched in the gut is actually Medicare. When you think about the population that's at highest risk for expensive medical care. In addition to that, you then have people who have, pre-existing conditions, comorbidities, these things where, they're probably on your plan, you already know about them. But the vast majority of the working public that are part of these private plans are not necessarily the ones who are going to be at highest risk for hospitalization and the costly claims. So that's why, when we're talking about testing and, that initial visit and sort of the care that's needed, we're not talking about, stop loss claims here. We're talking about death by 1,000 cuts. So, again, I get that because of just how big this pandemic is, there's that natural assumption that it's going to mean huge claims, but at the same time, I actually think it's going to be more about volume and less about the size of any individual claim. Brady, I'm not sure what you're hearing from clients as far as their concerns, as far as cost.
Yeah, definitely they're concerned about the cost issue as well. Like you said, Ron, I think we're hearing, thankfully, that the vast majority of cases won't result in hospitalization. But one thing that we did find as an attempt to find a comparison for what costs could be, and this data comes from Kaiser Health from 2018, but it looked at the average cost of an inpatient admission for someone with pneumonia among large employer plans, and they found that cost to be about $20,000. So that's an interesting number. Well, again, we just don't know yet for sure, but if you're looking for something that's somewhat similar, inpatient treatment for pneumonia is as similar as what you can find sort of so far, and that was the cost there. So again, like Ron said, most people affected by this outbreak are covered by something other than private insurance like Medicare, so it wouldn't be a concern, but that's sort of a ballpark idea of what the cost could be if you have an inpatient admission, but we just don't know yet. We're really operating in a number of unknowns. And what happens if, for example, the government has to build some kind of hospital or take over some kind of public or private land and use that for hospital space, would the government cover the cost of inpatient care in that sense? We don't know yet, but that's a possibility given the numbers that we're seeing in terms of who could be affected. So we'll have to be watching that. But I think it's like that you'll see the pressure put on employer plans and others. We just don't know the extent of what that'll be for the next few months.
One other thing, and Brady, we deal with, obviously we work with many private employee health benefit plans, and some of them have started utilizing a Medicare-based pricing methodology or reference-based pricing methodology. And 2 points. First, many of the times that we're dealing with a balance bill conflict and we're going back and forth with a hospital regarding a balance bill to a patient when it's not contracted, there's no network. Often in a moment of candid honesty, they'll say to us, we need to charge more to make up for the losses we suffer at the hands of Medicare. So if the vast majority of people who are being hospitalized for this condition for COVID-19 are indeed Medicare-enrolled patients, I do worry that $20,000 for pneumonia for hospitalization, if Medicare is putting a cap on what it pays at, let's say, a couple $1,000s, is there the possibility that these hospitals, which are going to be inundated by this, end up cost shifting to the private plans so that when and if you do have someone hospitalized, you're not only paying for your hospitalization, but for the shortfall on all the Medicare patients, which, again, these hospitals have admitted that's their MO. And the other thing that I think is worth noting, like I said, for those plans that are Medicare-based or reference-based pricing plans, we need to figure out how Medicare is going to price these conditions, these treatments. Are they implementing a new system of diagnosis codes, or are they trying to sort of shoehorn it into existing codes? And if so, what are those codes and how are they pricing them? So if you're Medicare Plus, my question becomes, well, what's the Medicare rate to which you're adding a plus when dealing with this new disease? So these are, again, all things that need to be considered and something that we're keeping an eye on.
Right. One thing I want to add sort of before we close here, Ron, is we just did have another presidential debate, the two contenders left in the Democratic primary at least. And I thought for those who watched, it was really an illustration in seeing how Medicare for all could be relevant to this discussion, because what you saw was one candidate, Bernie Sanders, try and make this crisis really about exposing the various cracks in our healthcare system, which we're all aware about as, those operating in the self-funded industry with respect to providers and, the cost and access. But I think that'll be one of the takeaways from this crisis when we look back, is we'll see, do politicians and other policymakers see this as an opportunity to push Medicare for all as, a solution to preparedness for the government and as a way to say, look, if we had this in place, the effect wouldn't be as bad. So we'll have to wait and see how that plays out into things. But I think a good first step for the government to have taken here was, and for frankly, many private plans which were going to do this on their own, which is to waive the cost sharing for at least the testing associated with this illness. But we'll have to see how serious things get in the coming weeks. Ron, as you and I are doing this podcast right now, there's another briefing happening at the White House where they're constantly giving updates. And so that's what we're going to do too. As you encounter more issues and you have more questions for our team, send them over to us. We're working around the clock on developing our own guidance and best practices. We're looking into these novel issues as they arise and are ready to help.
And Brady, to your point also, my parting thought is this, and we did just recently publish on our website and on social media a small blog post that I did. Your point about healthcare, it's a good one. And I think what's fascinating and what we're discovering here, and the point I tried to make in the post, is that ultimately, right now, it's less about the cost and more about the actual care itself. How much does it cost, Brady, to cure or to vaccinate against COVID-19? There is no cost because there is no cure.
We don't know.
Not the test, but to actually to vaccinate against it or to cure it. So, it's interesting that as people are debating the cost of quote unquote healthcare, as I've said in the past, they're really debating the cost of insurance. And in this case, how much your insurance costs right now has sort of taken a backseat to, is the healthcare itself prepared? We'll talk about what it costs later. Let's first ask, are there enough hospital beds? Are there enough masks and surgical gloves and supplies for the providers? It's fascinating how all of a sudden, this change where everybody can access adequate health care, the question then becomes, how much does it cost, to is the care in and of itself available. And I do think it's fascinating that it took something like this to maybe help us understand what I've been saying all along, which is that health insurance is not health care. Health insurance is a means by which you pay for health care. And it's unfortunate that something like this, is required for a bit of eye-opening, but so it is.
Yeah, I think we'll have much more to say on this. So will many others, I think, in the coming months.
Certainly. So everyone, please be well, take care of yourselves, take care of each other. Again, remember, even if you are the youngest, healthiest person alive, that doesn't mean that you can't potentially pass it on to somebody else. So do your part, social separation, wash your hands. I love that. And hey, listen, leave a roll or two of toilet paper for somebody else, okay? So on behalf of myself, Brady, Pat, and the FIA Group, be well, and we'll talk to you soon. Thank you for empowering your plans with the FIA Group.